In this video, we're going to be covering gum health, and we're going to keep things simple. We're going to discover the 5 different gum healths and the states the gums could be in. Now, we're going to start off with healthy gums. Right over here, we see that there is a white structure that's actually the tooth, and this is the root of the tooth. This porous thing is the bone that hugs and holds and supports the tooth, and the orangey pinky stuff around the tooth is the gums. As you could see here, where the tooth is, the gums are really close by the neck of the tooth, and the bone is very close. And in this case, it's healthy gums. Now you might be wondering, what is this tool? And we're going to cover everything about gum health in this video on a super surface area. Now, gum health in an overview, in a nutshell, it means that you have healthy gums. You might have gingivitis, which we'll cover today, mild periodontitis, moderate periodontitis, and severe periodontitis. These are the different stages of gum health, from healthy to super not healthy. Let's go dive in more deeper. Now, when we start with the healthy gums, as we saw in the first picture, we want to measure gum health with a ruler. We want to use something that gives us a reference point, something that gives us information to state that the gums are healthy. Now, over here, this tool that dentists or hygienists use is called the Periodontal Probe. It has black and white lines. Each of these segments are 3 millimeters. So that's 3, that's 6, that's 9, that's 12. We'll cover this more in depth in our other videos. But just to tell you that dentists call this ruler Periodontal Probe, and the meaning of it is perio means around, dontal means tooth, and probe refers to probing or checking something. And in our case, it's the gum depth that we are checking. We're checking from the top of the gum to the base of the space between the tooth and the gum. We're checking how deep that space is. As you can see, this ruler barely is able to go in to its white depth, so this is healthy gums. The gums are strong around the tooth. The bone is held high and strong around the tooth. This is an overall healthy environment, and we measure gums with a ruler, and that ruler's name is a Periodontal Probe. Now, when we move on, we see that we have first step gingivitis. Now, gingivitis is slight swelling of the gums. Well, what does that mean? Well, gingiva means gum, so this right here, the orangey, now it's red a little bit, angry or inflamed, is the gum, and itis means swelling. So gingivitis simply means the swelling of the gums. And that's the first sign that something is wrong with the gum health. Now, the next step is what's called mild periodontitis. Over here, as opposed to gingivitis, you see that in mild periodontitis, you have a little bit more swelling. If you look at the bony structures have decreased. And if you look at the tooth here, the tooth is nice and smooth, while here it's got food debris and some bacteria around. And the most important thing is to take a look at the ruler as it keeps going deeper and deeper in. That's what gives us, these numbers give us feedback on what the gum health is. Now, mild means slight, perio means swelling, dont means tooth, and itis means swelling. So slight swelling of the tissue structures around the tooth. So if you could see, there's mild, not very much swelling. Gingivitis is the swelling of the gums, but periodontitis already means that around the tooth, and we have some bone loss. If you take a quick look, there's bone structure here, slight swelling gums, but here in mild periodontitis we see bone loss as opposed to a healthy side. We see bone loss and more swelling of the gums. Now if we continue and we understand that mild periodontitis is slight swelling of the tissue structures around the tooth, and we know that the perio means around, dont means tooth, and itis means swelling. Now if we go on and we see moderate periodontitis, it simply means we have more bone destructure, more gum swelling, more bacteria, more debris, and the depth of the gums is deeper, and hence the ruler or the periodontal probe goes in deeper. Hence we have moderate periodontitis. Then goes severe. If you notice, from mild we have very little depth, moderate we have more depth, and severe we have very much depth. The other comparison is we see there's bone loss over here, swelling of the gums, more bone loss, more swelling of the gums, even more bone loss and more swelling of the gums. In this case, the tooth sometimes starts shaking because the structures that support the tooth are weakened. So that's called severe periodontitis. Now let's review gum health in an overview. You just learned healthy gums, where the bone structures in the gums are not swollen, and the dental tool that's called the periodontal probe barely is able to go in. We then covered gingivitis, where we have slight gum swelling, no bone loss, and the ruler goes in slightly, or the periodontal probe goes in slightly to check the gum depth. Then we have mild periodontitis, where the ruler goes in deeper, the gums are more swollen, we begin to see bone loss, and we have bacteria and debris build around the tooth. Then we have moderate periodontitis. Here we have even more bone loss. We have more swollen gums. The ruler goes in deeper. More bacteria. More debris around the tooth. And lastly, we have severe periodontitis, where we have even more bone loss, more swollen gums, deeper depths with the ruler, more bacteria, more debris. And that concludes our short and simple video on gum health.